Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'd like to help you guys understand medical trials. There's so much data that's coming at all of us in rapid fire succession every night on the news. And oftentimes I don't feel like in those 5-second blurbs on the news that we're getting the full details about the studies that the newscasters are reporting about. All studies are not equal, and all studies do not mean the same thing and don't have the same weight, qualities, and characteristics. There are essentially two different types of study design. The first is observational, and the second is experimental. For the first type, or observational, there are multiple different kinds of observational studies. These include a cohort study, a case control study, a cross-sectional study, and an ecological study. I'm not going to go into all the nuances of each one. A lot of these studies are trying to find whether an exposure to something like smoking is associated with a certain outcome, like lung cancer. They can be very, very long, over multiple years, or they might collect data over a certain time period and not necessarily look at causality. It may just simply ask the question, how many people in the United States currently have lung cancer? Sometimes the data is analyzed to evaluate the prevalence or incidence of something within the population as well. Observational studies are often used to generate hypotheses. Does A cause B? Or is A associated with B? Observational studies are usually one of the first steps to develop a hypothesis, which then is evaluated with an experimental study. So the second type of study is an experimental study. An experimental study has two groups of people. You first start with a control group where no intervention is given, and then there's also an intervention group where something is given to someone to test a certain hypothesis. One very important aspect to consider about an experimental study is whether it's double-blinded. That's an interesting and very important part of an experimental study. When something is double-blinded, that means that the person giving the intervention, the studier, or the caregiver, the nurse or their doctor, and the person receiving the intervention has no idea. They don't know whether they're in the placebo group or in the intervention group. And oftentimes the placebo looks exactly like the intervention group. For example, if I wanted to test a certain medication, I would develop a placebo that looked exactly like that medication, but that probably just had sugar inside of it. And I would not let the patient or anyone in the study know who is receiving the actual medication and who is receiving the placebo. This is very, very important because it prevents bias. We all want the medication to work. We want our study to be proven right. We want what we've developed to work. And numerous studies have shown when you don't have double blinding, randomly controlled groups, there's bias. That means you may not give someone who's especially sick that medication because you want your medication to look like it's working. Or the opposite. You may give only the medication to someone that's very, very sick in order to make that medication appear to work more effectively. So at the end of the day, the gold standard is a double-blind, placebo-controlled, randomized trial. But these are very difficult to do. They cost a lot of money and it takes a lot of research. But like I said, oftentimes these experimental studies start with observational studies. I'd like to talk about two recent studies worth noting. The first one is from the New England Journal of Medicine on May 7th, and it was an observational cohort study. This study was about whether hydroxychloroquine in patients hospitalized with COVID-19 in New York City had benefit. This study showed that there was no association with either a greatly lowered or increased risk of intubation or death in patients that used hydroxychloroquine. However, in the conclusion, they state that a randomized controlled trial with hydroxychloroquine in patients with COVID-19 are needed. So this was an observational trial to generate a hypothesis. Another big study in the Lancet on May 16th was a randomized, double-blind, placebo-controlled, multi-center trial from 10 hospitals in China. This is the gold standard. This study was whether using Remdesivir helped critically ill patients with COVID-19. And this study did show accelerated recovery in patients that received remdesivir and possibly a mortality benefit, although it wasn't statistically significant. Now, this was a gold standard study, which is why it was so important and people talked about it in the news. And that's why remdesivir is one of the leading medications that we're using right now in critically ill patients with COVID-19. However, one of the limitations of the study is that the patients were critically ill. We don't know whether using remdesivir is helpful for patients with mild disease, and because it's an IV medication, we can't really give it to patients in the outpatient setting. So, even though this was a gold standard study, there are still limitations to whether this can be applied to the general population. You have to specifically look at the patients that were studied in this particular trial. Did you know that there are currently over 1,400 clinical trials currently underway regarding COVID-19 treatments and medications? That's fascinating. If you'd like to see these studies and learn more about them, go to covid-trials.org. Thanks again for joining me.